Hello, this video is focused on transcranial direct current stimulation as a treatment for major depressive disorder. Major depressive disorder, or MDD, is a highly prevalent, life-altering mood disorder. Symptoms need to be present for more than a 2-week period to be diagnosable. The DSM criteria for MDD include low mood, sleep disturbances, loss of interest in activities, slowing of thoughts and movement, changes in weight, loss of energy, feelings of worthlessness, diminished cognitive abilities, and suicidal ideation. The cause of MDD is still unclear, although it has been shown that pre-existing genetic vulnerability, as well as biological and social factors, play a role in its development. Physiological research has suggested that MDD may be related to abnormality in interconnection between neurotransmitters, hormones in the brain, as well as general brain functionality. It is often associated with changes in cortical activity in the prefrontal area of the brain. Antidepressant medication has been shown to be beneficial in managing MDD, as well as therapeutic techniques including CBT and DBT being used in conjunction with antidepressant medication. TDCS has also been explored as a technique used to address MDD abnormalities. So what is TDCS? Transcranial direct current stimulation uses constant, low levels of electrical currents through electrodes that are connected to the head. These currents are either anodal, which are positively charged and cause excitatory effects, or cathodal, which are negatively charged and cause inhibitory effects. The electrical currents do not carry enough charge to cause action potential, although they spike the neuron's hyperpolarization or depolarization, affecting the neuron's firing potential. TDCS has also been shown to be safe in its use, with very minor side effects. These side effects may occur on the electrode location and can include skin irritation as well as tingling. Because of the relatively inexpensive costs to perform TDCS, as well as its portable functionality, sessions can either be performed both basic at home as well as in clinical settings. TDCS has been put forward as a technique that can create cortical change, even after sessions have ended, making it potentially beneficial for individuals who suffer from long-term depressive symptoms. Current research on implementation on TDCS suggests that it is beneficial when being used on the prefrontal cortex area of the brain. A small study examined the use of TDCS on patients resistant to antidepressant medication and found that on both the Beck Depression Inventory as well as the Hamilton Depression Rating Scale, scores relating to mood, including sadness, improved more than 30% with only 5 days of TDCS treatment. The treatment occurred twice a day for 20 minutes, with the nodal currents on the left dorsolateral prefrontal cortex and cathodal currents on the right dorsolateral prefrontal cortex. This research highlights the potential benefit of inducing excitatory effects to modify emotions to improve MDD outcomes. However, this study isn't definitive. It has shown some correlation, but no real direct causation. Also, because of the limited sampling size in this study, it is unlikely that this could be implemented and generalizable to the larger public. Other research has also shown mixed results regarding TDCS, with some suggesting that it may have limited to no effect on mood and a limited efficacy. Meta-analysis have also been conducted regarding TDCS and its relationship with depression, and found through randomized control trials that results have been mixed or conflicting and don't show definitive evidence of depression's improvement through TDCS. High treatment resistance has also been noted as something that negatively affects TDCS treatment. Predictors for effectiveness of TDCS for depression have also been found inconsistent, with some data finding no predictors and others suggesting that resting state EEG as well as pre-existing cognitive disturbances may affect results. TDCS as it currently stands has not been sufficiently researched and therefore proven as a tested method to improve mental health well-being. It has shown some benefit in small clinical trials, however these trials would have benefited from larger sampling sizes to make it generalizable to the public as a whole. Studies on TDCS would also have their scientific validity further strengthened by more longitudinal studies that assess the long-term implications of its use, including the lasting effect of the treatment. Future research also needs to examine what other areas of the brain may benefit from being targeted to address MDD symptoms, because as it currently stands, the bulk of the research is focused on the prefrontal cortex. There is also a gap between its use in clinical research and practical use. In the clinical environment, it is shown to be of benefit, but in a more basic use, like at home, it hasn't been proven due to limited research. Increasing knowledge and testing methodology of TDCS on both experimental and basic use will provide greater insight into its validity. Furthermore, TDCS needs to address mood disorders, including MDD, in conjunction with already established methods like antidepressants and behavioral therapy. To say the least, the current research and the data obtained and analyzed does provide insight and often reflects well on TDCS, but more examination is needed. Should further research show TDCS as an effective treatment for depression, it could be provided relatively cheaply and provide ongoing assistance to prevent relapse of MDD-related symptoms, improving the quality of life for those who need it. Thank you for watching.